Hello, my name is Nurul Nadhirah binti Azmi. I am from HS2446A. For the first question, the patient complains of pain at the posterior medial thigh. Alright, and then first we need to observe if there is any swelling or any deformities at the area. Okay. First, we need to see any swelling, and then next we must do palpations to assess for any tenderness or maybe spasm, and ask the patients if there is any pain persist. Ada rasa sakit tak?
Ada.
Dekat area mana?
Situ lah.
Kat badan dalam ni ke? Okay. The patient complains of pain here, and then cuba bengkok lutut, boleh tak? Lagi? Bengkok lagi? Boleh lagi?
Boleh lah.
Okay. Then we ask the patients to do active range of motions of the knee. The patients might be having a problem with the hamstring area. After the patients do actively range of motions of the knee, I am going to do passively movements of the knee to check for anything. Okay, saya buat ni, nanti awak cakap sakit ke tak Okay ke?
Sakit.
Okay, the patient complains of pain at the area sini ke?
Yes.
Okay. And then boleh duduk macam tadi balik. Ask the patients to okay, awak angkat kaki awak macam ni boleh? Cuba angkat. Is it okay? Ada sakit? Sakit dekat mana? Area sini tadi?
Yes.
Okay, the patient complains pain at the same area, and then we passively do the range of motions. Is that okay? Okay. And then we might do some special tests such as 90-90. We check for the hamstring flexibility. The patient should be lying. Okay ke? Ada rasa apa-apa?
Sakit.
The patient complain pain. Ada rasa tarik kat batang? Okay. The patient may be having hamstring tightness since the patient's complain rasa tertarik kat belakang. And then, okay. For the special test, maybe the patients can do Poranen Orava test, which is the patients might be doing like this. Cuba buat macam ni. And then see if there is any pain. Awak kena diri.
Hah?
Diri. Okay, angkat kaki letak. And then sini. Okay, dia rasa sakit kat belakang. The patients might be having a hamstring strain, but because the patients complain of pain at the posterior medial thigh, and then whenever we are doing the active range of motion, passive range of motions, he complains of difficulty and pain at that area. And also whenever we are doing the special test, which is 90-90 and Poranen Orava test, the patients complain pain and tightness at the hamstring area, meaning that maybe there is a flexibility problems here. Okay. Okay, for question 2, which is the patient's complaint of instability in his lateral side of the knee due to recurrent of sprain, and then we need to apply the rigid tape. Alright, first stabilize the patient's knee. Make sure the ankle is in 90-degree positions. The patients might be having the lateral ankle instability. So, first, we create an anchor point at the distal leg. And then, another point, we put it here. go beyond the heel of the patient. Okay, for this process, repeat for 2 times. Are you okay? Okay, to provide the stability, we need to do a figure of 6. Start from the medial side. And then go below at the Achilles tendon. And go to the ankle point. On the inside, go to the repeat for 2 times, and then vice versa, start from here, go down, okay. This kind of strap needs to be performed 2 times, and then lay it down again for the ankle point. And cover all the exposed area. Make sure the ankle is in 90-degree position. That's it. Alright, for the third question, which is the patient complained of pain at the tibial bone after training, and then for the first 3 days, and then we need to apply kinesio tape to manage the problems. First, put the patient's position in this plantar flexions ankle, and then stabilize the knee. Okay, may I know where is the pain? Kat mana sakit?
Yeah.
Kat sini. Okay. For this patient, he might be having the medial stress syndrome, which is the shin splint, maybe due to the nature of running or walking. So, first, measure. Pause. Then ankle naik in position. Ada lagi relax. Buat neutral. Straight and ankle point. Ni letak kat distance leg ni. sakit tadi kat sini. Okay, with no pressure, with no tension at all, just lay it down. And then okay, apply 50% stretch halfway. And then lastly, okay, play it down with no stretch. And then create an anchor again. Okay. Make sure put it above the area of pain. Lay it down with no pressure and then create a 80% stretch and lay it down with no stretch, zero tension. For another anchor, put it below the area of the pin. Then again, create 80% stretch or tension and lay it down with no stretch, with no tension. This is the kinesia taping for the shin splint or maybe medial stress syndrome that usually happen for the marathon athletes.